Assalamualaikum doctors. In this video I am discussing a recall history, that is primary ciliary dyskinesia, and the task is like that. Come 15-year-old boy with primary ciliary dyskinesia diagnosed on the age of 2 years came with worsening of the cough few days ago. So first we will find that there is cough worsening. So as usual we analyze the cough. How can we analyze the onset, when started, how long suffering this cough, anything make it better, anything make it worse, then is it first time or recurrent occurred, when was the last time, the cough is dry or productive, what about the color of cough, amount of cough, is there any triggers present like cold, pollens and animals, timing of cough, is it more at night, is it related to exercise, is there any shortness of breathing or cessation in infant or apneic we ask, any musical sound, any cyanosis, does he have any chronic illness. So when any chronic illness we find, then they will tell that he is diagnosed case of primary ciliary dyskinesia. Any other concerns, any chest pain, pox, snoring sound, nasal polyp, itchy nose, and if it's seasonal, recurrent any ear bug, if chronic, ask about the previous sputum, contact to COVID patient. So again, the chief complaint is that worsening of the cough. We analyzing the cough. How? First, onset, course and duration. When started, how long suffering this condition? Is that anything make it better, anything make it worse? What about when, is it first time occur or recurrent occur? When was the last time? If the cough is dry or productive? What about the color of cough? And amount of cough? Any blood present or not, we ask. Then triggers. Is that any cold, pollens, animals triggers? What about the timing of cough? Is it more at night? Is it related to exercise? Is there any shortness of breathing or cessation? Shortness of breathing or cessation for infant, we asking that apneic infant. Then is it related to exercise? Any musical sound, any cyanosis, does he have any chronic illness? So chronic illness, any other concerns, any chest pain, pox, snoring sound, nasal polyp, itchy nose, and if it's seasonal, recurrent earbuds, if chronic, ask about the previous sputum, contact to COVID patient. So we understand that these are the chief complaint analysis. Then chronic illness, then FWSL, as usual, fever, weight, activity, sleep, we are asking, and then systemic review, and past history, we know that. TIOA, that is any previous trauma, treatment, traveling, blood transfusions, any surgery, then birth history, vaccine, allergy, nutrition, diet, and family, social, psychological. So normally primary ciliary dyskinesia, what history will ask? First of all, chronic cough, and the criteria is cough is wet. So when we ask about the dry or wet cough, the cough is wet. Then is there any nasal polyps like chronic nasal discharge, reduce the sense of smell and snoring. So how about the sleep, we are asking. So another feature is nasal polyps, chronic nasal discharge, reduced sense of smell and snoring. Number 3 is chronic sinusitis, that is thick discolored discharge, blocked nose and painful cheeks, nose and forehead. Okay, so chronic sinusitis, the features are thick discolored discharge, blocked nose, painful cheeks, nose and forehead. Number 4 is chronic otitis media and hearing problem. So they have repeated ear infections and hearing problems. Number 5, they have prenatal history, that history of neonatal persistent unexplained tachypnea. So from the birth they have shortness of breath or tachypnea, they tell. 6, there is recurrent pneumonia without risk factor. So they have repeated admitted in hospitals. We find in the history recurrent chest infection. 7 is surgical history, like primary ciliary dyskinesia is associated with loss of surgical problem like tracheoesophageal fistula, corrections, shunt operations, abdominal operations. Okay. Family history of similar condition in the family, as it is an autosomal recessive condition. History of male infertility in the family. So you ask that any infertile person present in the family or not. Then social history like smokes, environmental and home situations. So social history are smokes, environmental and home situations. These are details we take, and additional vaccination history, vaccinated or not, any extra vaccine taking or not. So this is all about primary ciliary dyskinesia. And the DD we can keep like primary ciliary dyskinesia, DD, cystic fibrosis, bronchiectasis, Carter syndrome, immunodeficiency, asthma. These are asthma, and also our child patients. So puberty we ask it because they have delayed puberty. Infertility is one of the problem. Head size we will ask because they have hydrocephalus, head size in increase. So this is anytime any test done, what is the test report? Because visceral situs inversus present, dextrocardia. So you need to ask that anything, any imaging test done, anything they do or not. So this is all about primary ciliary dyskinesia history. Thank you.